Welcome to dBrief. I'm Chetna Sharma. I'm going to present you the highlights of the webinar. Precautions in clinics and dispensaries in COVID situations. This webinar was conducted by IMA Maharashtra on 20th June 2020 and is sponsored by DG Shield. As the battle against COVID-19 rages on, the frontline warriors, our doctors and healthcare workers, are at the greatest risk as they try to open up clinics. DG Shield, in association with the IMA Maharashtra, conducted a webinar which detailed out the precautions doctors must take as they open up their clinics again. Speakers included Dr. Avinash Bhondwe, President IMA Maharashtra State, Dr. Ravindra Kute, Director of Studies IMA CGP Maharashtra State, Dr. Rajan Sancheti, Honorable Secretary IMA Pune, Member of IMA CGP Maharashtra Council. The keynote address was delivered by Dr. Archana Pate, MD Consultant Physician Intensivist. Dr. Avinash Bhondwe presided over the webinar by addressing the current Unlock 1.0 scenario from the doctor's perspective. He focused on the escalating infection rate and mentioned a few things that GPS should do before they enter their clinics.
We have rather said that above 65 should not come, but there is no official standing for that. And secondly, on the other hand, if we keep our clinics closed, they may give us notices that under Epidemic Act that you have kept your clinic closed. So we inquired about that. So this is, you can say, the not very official this thing, but unofficially, these notices will be sent to the Medical Council, Maharashtra Medical Council, and Maharashtra Medical Council will decide. So it's up to the Maharashtra Medical Council may give us some relief that above 65 or above 55-year people cannot practice or they can be exempted. Right now, there is no official guideline. Secondly, it's up to family members. Many of our doctors have rather accepted that their family members say that please do not go for just for as per their own value, as well as they may get infected because of those people, because of the doctors, the family members may get infected. So it's rather our individual decision, sir, whatever you feel like. But the thing is that there is no official guideline from the government or from the ICMR or even from the medical council that below this age, you are above this age, you are exempted, or with comorbid conditions, you are exempted. They are all assumptions, sir.
Dr. Archana Pate started her talk by delivering a critical message to all senior doctors. She strongly recommended that doctors above the age of 55 or those who have comorbid conditions refrain from opening the clinics for the foreseeable future. She highlighted the need for such doctors not to turn into patients and find alternative avenues for helping their patients, such as telemedicine.
The guidelines say above 60, but I would say to be very sure above 55, please take care of yourself first. If you do not want to practice in this pandemic era, please go ahead and close the clinics because you are very important. So that is the first word of caution to everybody. Now we go beyond that. So everybody somewhere or the other is going to have to start working in the pandemic era sooner or later. Now, certain things, if we follow, I think everybody will be reasonably doing well in their own clinics. Okay, there are certain infection control practices that everybody needs to follow in their own clinics or in their own OPDs to be able to protect themselves, their own staff members, because that is our first point of concern, that we should not get infected and we should not be the point of transmission of infection. So the first criteria is to protect yourself and to protect your staff. So for that, there are certain infection control practices. If you follow, you will be reasonably doing okay in this pandemic scenario. One is you did not practice for your routine hours. Like if you were practicing initially, say for 5 hours in the morning, 5 hours in the evening, Maybe you may not do that. You may practice for a fixed number of hours. You may sit for more number of hours, provided you are going to be taking calls and patients by appointments. And if you're spacing out your patients, spacing out your patients and your appointments is very, very important. There should not be any rush in your OPD, basically. So if we see in a family physician's OPD, at any given time, there are 20 to 30 patients who are sitting in the OPD area. And the OPD area being small, it becomes very, very difficult, to tell them to maintain social distancing or stay away or stand at a distance or wear a mask or, everything is too difficult. So first thing is start taking appointments and see your OPD by appointments only. I think most of you are giving phone numbers to your patients. Try and avoid patients with very simple symptoms. If they have, you can consult them by telemedicine. Telemedicine has very much been approved by MMC. There are certain guidelines set for it. The patient has to be known to you. You may have to treat them for the diseases that you are aware of. Maybe your known patient for diabetes, hypertension, taking treatment from you regularly, and all you have to do is continuation of medicines. Go ahead and do a telemedicine. Simple treatment of say vomiting or some headache or something, you want to prescribe them treatment, do it by telemedicine. You have to write the prescription on your own letterhead with the complaints, with the prescription, your signature on it, and you can send it to them by WhatsApp. Charging, not charging, that is entirely your prerogative how you do it.
She went on to discuss infection control practices and shared strategies that can minimize the risk of COVID-19 exposure for doctors and their staff. Dr. Pate recommended that clinics implement triage procedure and comprehensive telemedicine processes to reduce the number of patients visiting the clinic. Dr. Pate's guidance on implementing triage procedure can be effectively implemented using DigiShield. DigiShield is a unique solution that has more than a dozen features designed to help doctors effectively operate their clinics during and after COVID-19. DigiShield enables you to conduct a quick and effective COVID-19 career risk screening of every patient before they come into your clinic. DigiShield maintains continuous from government agencies about hotspots and containment zones. DigiShield gives you a red, yellow, green risk profile for every patient before they come in so that you are empowered to triage patients effectively and minimize the risk of exposure to you and your staff. Primary COVID screening of every patient once they enter the clinic is very essential. Use of PPE equipment is highly recommended. Dr. Pate mentioned further that clinics should keep ACs off and maintain ample air ventilation. While using PPE kits, care must be taken during the doping process. It is very important to note that PPE kits should not be reused by sanitizing the suits or the mask. Dr. Pate went on to say that doctors who are wearing PPE suits should avoid the use of mobile phones when they are in their clinic. They should either keep the mobile away or give their assistant to attend any important calls. Under no circumstances whatsoever should they be using their mobile while they are treating their patients, as it poses a high risk of transmission. She mentioned that patients should be asked whether they are visiting the clinics from any of the containment zones declared by the government. This will help the doctors to understand the patient and treat them or advise them in a better way. Solutions such as DigiShield should be used to effectively determine containment zone history for the patient. With a view on enhancing public-private collaboration to fight COVID, Dr. Pate mentioned that doctors should be coordinating with the medical officers, epidemic officers in charge of their areas to help manage the on-the-ground situation.
Every area has got their containment zones published. You need to take them from your medical officer of health or the health officers that are looking after your area. They will be giving you containment zone lists. If you don't have it, please ask for it.
The role of the doctors and the health authorities when the patient is tested positive for COVID was also discussed during the session. If the doctors advise any of the patients for a COVID test, It is the responsibility of the doctor to inform the appropriate government authorities about the report of every patient, even if the test is negative. Dr. Pate and the rest of the speakers provided guidance to doctors on how they should be proactive in informing the authorities if they are choosing to keep the clinics closed. Thoughts were shared on how to keep clinics closed while protecting doctors from action by authorities.
If the patient is reluctant to go to the fever clinic, and if the general practitioner wants to prescribe fever tests in private, they can very well do it. But at the end of the day, they are supposed to send a mail of which fever patients they have seen, and they have prescribed the COVID test, not all fever patients, by mail to the KDMC authorities. So this is what we are doing in our area, or we are asking our GPs to do in our area. So please, have some coordination with the medical officers in your area, the medical officers or health officers in your area. There are epidemic officers appointed in all areas, and they are in charge of taking the fever patient details from you. Okay. Now, any patient, if you have advised COVID test, the patient will come back to you with the COVID report. Please understand the COVID reports are informed by the laboratories. Legally, they are bound to inform your local authorities, but you are also legally bound to inform your local civic bodies.
Questions from the audience were also addressed by Dr. Pate. A viewer asked, what should doctors do if while attending patients, they feel itchy in their nose? She suggested that doctors should never remove the mask to scratch their face, not even after sanitizing their hands, as the face is still exposed to the virus, and virus particles from the face can enter the nose while scratching the nose. Questions were asked about injection protocols and if they should be modified. It was suggested that doctors should refrain from giving injections unless it's absolutely necessary, as the exposure to the patient is quite high in such cases. Masks are scarce and costly. Doctors were advised to keep the mask one per weekday and hang them for air drying at the end of the day at a particular place. Masks can be used up to 5 times before they should be discarded. The mask should be removed gently from bottom to top without touching the outside surface of the mask, as this may cause exposure. To stay reasonably safe during this pandemic, Dr. Pate advised maintaining safety practices at all times, during clinic hours and throughout the day. Effective donning and doffing protocols should be followed that ensure that infection and contamination does not occur due to viral particles being dusted into the air while removing the PPE. Dr. Pate also addressed the important topic of modification of the clinical exam process to reduce risk of exposure. Typical exam includes palpation, auscultation, and other standard procedures.
Do not try to palpate everybody. Do not try to auscultate everybody. Go more by the detailed history. Okay. Go more by your inspection. Okay. Go more by non-touch techniques. Only where you really feel that you need to touch. If the patient is having abdominal pain, if you feel that you can prescribe medicines, go ahead and do it. You feel the pain is severe. What more things are we going to achieve by auscultating? Please ask for sonography.
During COVID, it is recommended that doctors conduct a detailed history of the patient's present illness and conduct inspection using non-touch techniques as much as possible. In the event that palpation and auscultation must be performed, it should be performed and infection control. Disinfection procedures should be followed. Doctors were advised to maintain as much as social distance from patients as possible and to limit the number of family members that are allowed in with the patient in the clinic. The downside of distance examination and the medico-legal risk of it were also addressed. Dr. Pate suggested that patients should be referred to a hospital whenever doctors are not sure about the patient's condition and physical exam cannot be comfortably performed. A question was asked about starting OPDs in containment zones. The panel guided that clinics in containment zones should follow government rules for opening clinics. Dr. Pate suggested that a walk test should be conducted for patients coming into the clinic. Oxygen saturation should be checked and then the patient should be asked to walk for a few minutes. If the saturation level drops by 2-3 points, patients should be considered as desaturating and COVID should be suspected. Wearing mask is a must, even if shields are used. Dr. Pate cited the dramatic escalation of COVID cases in Dombivli over the last few weeks. She mentioned that most patients that are presenting with fever, cough, and cold are testing positive for COVID-19. She urged doctors not to manage fever, cough, or cold conservatively and to err on the side of caution and conduct a COVID test on suspected patients to make sure. The speakers discussed what to do in the event a patient dies of unknown causes. Doctors were advised to inform the authorities if they suspect the patient died due to COVID. The authorities have the final decision on if a COVID test should be performed or not. Dr. Sancheti shared valuable information on behalf of IMA Pune that 3 hotels have been reserved for quarantine and 3 hospitals reserved for treatment for IMA members. Focusing on payment collections, doctors are advised to receive payments by digital payment services and avoid taking cash. In the event that cash is unavoidable, it is unnecessary to sanitize the cash as research indicates that the risk of fomite transmission is low. Sanitization of clinic, equipment, and terminal disinfection between 2 patients should be done thoroughly with the use of proper disinfectants such as hypochlorite. 7 steps of hand hygiene should rigorously be followed. Dr. Pate clarified that normal hand wash should be for 40 seconds and only sanitizer cleaning for 20 seconds is recommended. Information about the uses of antiviral was provided. Practitioners were advised to seek help in case they get infection and not to treat themselves. The speakers encouraged the use of telescreening, telemedicine, touchless prescriptions, and touchless payment. Sanket Barale, founder chairman of DG Shield, explained that DG Shield has telescreening, telemedicine, touchless prescriptions, and touchless payment, and more. And it is completely free for life for all doctors. He highlighted the features and benefits of this service, which is AI-based, and how telescreening has been proven to minimize risk and simultaneously improve the practice experience for patients.
So we feel that having an end-to-end solution like this, from a telescreening, a telemedicine, prescription writing, which is FDA compliant, then doing sort of analytics on that prescription to help inform potential patients that have COVID, automating the reporting to the government, and then doing contactless payments, and being able to be offering that for free to doctors is of great value. And we're honored to be supporting this dialogue with the IMA, and look forward to further engagement. So just to answer your question, Dr. Sanjay, that is what we have done. It is available on both the Android and iOS store.
To watch the entire webinar, please visit our website at www.dgshield.me and click on the dBrief menu.